Welcome, everyone. Hopefully you can hear me. This is Mike Ladewski. We're going to talk a little bit about bike fit today. I have some slides to share with you, and then we're going to try to do a live demonstration of going through some of these steps as best we can, given potential challenges with the technology. So we'll do our best. So, a lot of people ride their bike, more so probably recently than before, just because of the situations we find ourselves in. And there's many reasons that it's important to have a good bike fit. And I think we would all suggest that any more activity that our patients can get is a good thing. And so the more comfortable people are on their bike, the more likely they will get on their bike again and ride for longer periods of time. So it's important for people to feel comfortable on the bike in order for them to enjoy the experience, to want to do it again and again and again. Another thing that's important as far as fitting someone properly on a bike is the fact that there's a large amount of injuries that can happen when riding, and if someone's not quite fit correctly on a bike, it might put them at greater risk from some of these mishaps. So this is some pretty old data, but anyway, bike accidents are pretty common, and if there's anything we can do to address that with proper fit on a bike, it would be a good thing. And if you think about cycling, at least some people, they do it quite a bit, and if there's an average of 80 revolutions per minute average, that's 4,800 per hour. That's 30,000 over a 100 miles or century bike ride. So if someone's fit is not completely right and it's leading to some inadequacies in their pedal stroke, then those repetitive activities can build on each other and cause a lot of overuse injuries. So it's important to have a good fit for that reason as well. And then another reason would be to try to optimize the performance on a bike. I'm not sure if you guys watched the Lance Armstrong, I guess it would be a documentary, I'm not sure what it was, on ESPN not too long ago, but we found out it really wasn't about the bike. But yeah, it is important to have a good fit to try to maximize performance. So if you get someone comfortable on a bike, they might just really be able to kind of take off and meet their potential, as you can see this gentleman doing. So to start with the discussion of the basics of the anatomy of a road bike, and that's what we're going to talk about today is a road bike. There's, of course, a bunch of different types of bikes out there. We're going to just talk about a road bike. And you can see all the different tubes on the bike, from the top tube, the down tube, the seat tube. You can see them all there, the head tube. The saddle, of course, is where the rider sits. And then at the bottom, in the middle of the gears, is this part called a bottom bracket. So that's going to be important when we start doing some of these measurements. And then the stem as well, which is right before the handlebars. So those are kind of going to be some of the parts of the bike that we're going to mention as we go forward here. And today we're going to try to do a static fit, which is the way that a lot of people had been fit on a bike. I originally did this talk quite some years ago. And since that time, even at that time, there was more dynamic fits that were coming out. And there's a bunch of different ways to do these. Again, we're going to talk about static fit and some measurements that people have suggested. And that can differ quite significantly from a dynamic fit, in where riders are, they can be put on dartfish, and they can have different types of machines that are meant to be a bike, and which each one of these machines can be the distances of all those different tube lengths can be minimally changed, and then the athlete can be riding on a trainer, and things such as power output can be measured to see if a little tweak here or tweak there can improve that. So again, we're not going to do that today. We don't have any of that technology, but just so you know, that's out there. We're going to do a static fit, which involves just our athlete on their bike on a trainer. Just a little bit more about dynamic bike fitting. So these are a couple pictures. You can see this athlete has some of those markers set up, and they can then report back to different types of software, and there's different philosophies with how to fit someone on a bike, both with a static fit and a dynamic fit. And then all that information can be gathered in software, and that software can produce different data outputs, which then the bike fitter could then change the bike or the fit of the bike for the athlete, and that would change. For instance, in this picture, it shows the path of the right and the left knee compared to the bike frame. And again, here's just another picture showing a lot more data that you can gather with doing more of a dynamic bike fit. And from this specific example, this is showing the athlete on the left side of the screen is her before, and the right side is her after. So you can see they just made some not too aggressive changes, but if you just kind of look at it grossly, you can see her position of her body looks to be a little bit more comfortable for her, perhaps. So we are going to try to now go through some of these steps, actually, after just a brief mention on the height of the frame. So again, this is for a road bike, and that top tube, if you remember from the earlier picture, if you had this top tube and the athlete's standing over the top of the top tube, there should be a couple inches of clearance there. Again, for a road bike, and in this picture they mentioned for mountain bikes and hybrids, it should be even greater. So bikes are sold with a certain, most of them, some are custom made, but most of them are sold with a certain size of a frame. And then you can kind of make some of these tweaks going forward from there. So if someone's looking for a general idea of the size, they should at least have a decent amount of clearance there. And these are the steps that we'll go through now in regards to, once that hopefully the proper size of the bike is with the athlete, then these kind of little tweaks that you can do from here on out. So I'm going to try to switch between the slides and a video here. Bear with us. We're going to try to make this work. So in the steps we're going to go through, we're going to start with the shoe cleat pedal interface, and then the pelvis saddle interface, and then the hands and the handlebar interface. So these are the 3 points of contact that the rider has with the bike. And as you can see, they're pointed out in that image above. So the first is the cleat position. And if people aren't necessarily aware of, this is for cycling shoes that have cleats on them that then engage into a special pedal on the bike, versus, just having the regular pedals that you put your regular shoe on. So the idea.
I have a meeting here, and they just called me about another patient. So I've got 16 different things happening at the same time right now.
So the idea is to have the cleat on the bottom of the biking shoe in a certain position so that it's over the first metatarsal head, or at least the spindle axle is directly over the first metatarsal head. That will allow maximum power and hopefully prevention of injury. And maybe if we can try to switch, take a look at your shoe, or just we can try it. So unshare here. Let's see, stop share.
Can you click into that?
Yeah, maybe you can show them.
There we go.
Okay, so try to get this so it works. So you can see there's different cleat systems that can be purchased to put on the bottom of the cycling shoe. And this cleat works with the pedal. And so this cleat can be adjusted to be positioned on the bottom of the shoe, either forward or backwards or left or right. And then you can see that this cleat then locks into the certain type of pedal. So if this interface isn't completely right and the foot is maybe turned inward, or if it's not right over the spindle of the pedal, they won't get maximum power production, and it might lead to some overuse injuries if it's stressing one part of the anatomy dynamically over and over and over again. So that's what we start with first. Let's see. Now, should I try to share this again? Okay. So again, the idea would be to adjust that cleat so that it's positioned on the bottom of the shoe, so the first metatarsal head lies directly over the pedal axle, which I didn't show you, but I can show you again. So the pedal axle is, if we take it over here, so you guys can see that. That's this part right here. So this is the axle when the athlete goes ahead and spins or pedals. That's the axle that the cleat shoe interface revolves around. Right. Okay, so this is another graphical representation of kind of that axle and where it should be. If you have some patients who have leg length discrepancies, greater than 6 millimeters is considered significant. You might want to think about putting some shims either between the cleat and the shoe, or using orthotics in the shoe. Moving the cleat back on the longer leg will essentially shorten it too, which might make it more equal to the other side. Some strategies you can use for leg length discrepancies. So that was the shoe pedal interface. The next one is the saddle interface. And again, this is just a suggestion of a way to dynamic or statically fit someone. It's a formula. So what you do, as the picture shows, you get the inseam length of the athlete and then in centimeters and multiply that by 0.883. And that would give you the saddle height, which that dimension is measured from the center of the bottom bracket, if you guys remember what that part was, to the top of the saddle. So for instance, in our athlete, we get that measurement as best we could. You put them up against the wall or something like that. They can maybe mark it with a book where that meets, and then you would take you would measure that out from the floor. You get that dimension, multiply that by 0.33, or I'm sorry, 0.883, I think it was. Yeah. So let's see what looks like 81-ish. So if someone wants to do that math.
Gynecology.
And then what we would try to do is put that measurement then after you do the multiplication from the bottom bracket to the saddle height. You guys can see it around me. So whatever 0.883 is of 81. Oh, sorry, yeah.
71.5.
So it looks like he's right at 71-ish or something. So the idea that he would be kind of close to where, again, this suggestion would be. Not too high or not too low. All right. Very good. So that's one way to measure the saddle height or a suggested saddle height. Another one would be measuring knee flexion. So with the pedal at the 6 o'clock position, adjust the saddle height so the knee is flexed between 25 and 30 degrees. So for this, you need to get your going limiter out. Have the athlete placed at 6 o'clock. So you try to, as best you can, get that angle. And it's it can be a lot easier if you have those special tools. So the idea would be to have that between 25 and 30 degrees, right? What's that?
Don't be confused by the hypocrite.
They don't want to.
I didn't even notice that.
Okay.
We're doing the head.
Yeah.
Knee. Yeah.
There we go. So at 6 o'clock, yeah, he's right around 30 degrees. So again, close to where he should be, according to the suggestion. Okay. This is kind of just a, shows both those different ways of trying to measure the saddle height that we just went through. And then, so there's the saddle height, and then there's the saddle fore and aft position. So we try to measure this by having now the pedal at 3 o'clock, and you drop a plumb line from the inferior pole of the patella, and the line should hang over the pedal axle that we talked about before. Noting that the saddle should be level. So if you have the athlete get in that position, and you take, yeah, plumb line. You go from the interior pole of the patella. This might be difficult to see. Your camera. So at least on this athlete, his spindle is further back at 3 o'clock. So that can be adjusted with bringing the saddle either forward or backwards. You can see how that affects where his knee is. and is shown in the lower right-hand corner of that slide. Okay, so we did the pedal bike interface, or the cycling shoe cleat pedal interface, the saddle interface, and now the last one is the stem height. So, and again, according to this philosophy, it's more of a subjective way of measuring where to be. So with the hands on the brake hoods, which is a part of the handlebar that has the brakes on them, versus the drops, which are below there, the torso should flex around 45 degrees in relation to the non-sloping top tube. Now, our athlete's bike has a little bit of a slope to his top tube, but and then the vertical distance between the top of the saddle and the top of the stem should be 1 to 3 inches, with the stem below the saddle. So if we take our athlete, you can see his hands are at the brake hoods. And if you try to kind of just get a best you can measurement, he's around 50-ish degrees. And then if you were to get off of the bike, the other way is to think of the saddle height should be they mentioned this 1 to 3 inches from the stem, which it looks like that very well could be the case. Okay. So the stem length or extension, that stem can be made to be further extended away from the bike. And the idea to get a measurement of that would be to have the rider in the drops now, instead of with their hands on the brake hoods, but in the drops of the handlebars, and the knees at the maximum height in forward position. And a suggestion would be to have the less than 2 inches between the elbows and the knees when they're in the forward position. Or with the rider in the drops now, still, and looking down, the front hub of the bike should be obscured by the transverse part of the handlebars. So we'll try to show you that on our athlete. So you can see there's the height, or the difference between his elbows, with a little bit of flexion usually in the elbow. So he's not going to hit himself there. And then the other idea is when you're looking down from the top of the bike, this horizontal part here should obscure the front hub of the wheel, which is down there, from the athlete's view. Okay. So again, this is one way to do a static fit. This is an overview of the steps that we took. First, the foot shoe cleat pedal interface with the first metatarsal head lying over the pedal spindle, the saddle height with the knee angle flexed between 25 and 30 degrees when the pedal is at the bottom downstroke, or that formula of the saddle height, which is measured from the bottom bracket to the top of the saddle using the rider's inseam, multiplying it by 0.883 in centimeters. Then there's another one, another suggestion there added. It's C. Then this, so we have the saddle fore-aft. That was the saddle height. The saddle fore-aft. The plumb drop dropping from the inferior fold of the patella, falling directly over the pedal spindle, with the crank's position forward and parallel with the ground, or at 9 o'clock position. Saddle tilt, usually we didn't really specifically talk about that, but that should be level for the most part, again, as a general fit. And then the stem interface. So 0 to 3 inches below the height of the saddle. We showed you that a little bit. With the hands on the brake hoods and the arms slightly flexed, the torso should be around 45 degrees in relation to the top tube. And or with the hands in the drops, the torso and top tube angle should be about 30 degrees is another suggestion. Stem length or extension, that's the last one we showed. The knees at their maximum height and forward position, the distance between the knees and the elbows around 2 inches. And or from the rider's view in the same position when looking down, the front hub of the front wheel should be obscured by the transverse part of the handlebars. The next couple slides are just going to show some potential suggestions. If you have an athlete who is seeing you because they have a complaint, and some suggestions on how you might approach that, and things you might talk to them about trying as far as the fit of their bike and how that might affect their complaint. So you can see here, this is an attempt to show the stroke, the pedaling stroke, and the different muscle groups that are activated. And so if you have someone with a specific complaint, you can see where in that stroke that muscle unit might be at most activation. And so that I thought that this might help us kind of understand the suggestions coming up as far as how to adjust bike fit based on a potential complaint by an athlete. So some of these don't necessarily involve that pedal stroke, but just general position on the bike. So if someone has posterior neck pain, scapular pain, they might be reaching too far, too much forward on the bike. So you'd want to relax their position. So do things so they're not so reaching out so far, including shortening the reach. You could raise the stem height or the front of the bike so they're more upright. And then just suggestions to ride with their hands on the top of the hoods or not in the drops, because that all kind of lengthens someone's out and it reaches them really, really forward. So neuropathy, too much pressure on the bars, which can happen with any of these things. The bars being too low, so too much weight is being put on the front of the bike. The saddle's too far forward, or there's excessive downward saddle tilt. So you would try to affect all those things as they suggest. Someone has low back pain, again, they might be just too far out forward on the bike. So those similar suggestions. And then getting more towards potential overuse injuries based on their pedal stroke, and with the tibialis anterior, Achilles, and how if the saddle height is not optimum, that might put excessive stretch on those body parts. So adjusting the bike fit to lessen those excessive stretches on those body parts might be helpful. With the foot in the cleat position, again, you want to try to make sure that that's optimized. That can lead to pressure on certain parts of the foot that might lead to that complaint. And then perennial numbness, if the saddle's too high, there's too much pressure there, or if it's tilted excessively up or down. So you can attempt to try to adjust the saddle to help with that. This slide shows specifically some adjustments you might consider for knee pain and the location of the knee pain. So whether it's anterior, medial, lateral, or posterior. And again, if you think back to kind of the pedal stroke and the muscles that are being activated, that kind of helps inform us on this, the suggested changes we might make. So if the anterior part of the knee is bothering the patient, maybe the seat's too low, too far forward, they're putting too much power is going through that push of the stroke. So you might want to move them back. Medial is similar to lateral knee pain. So perhaps the cleats are pointing out and or lateral in, and that's just putting undue excess pressure on that part of the knee. Certain cleat systems they have a degree of float, so even when the shoe is clipped in to the cleat, it can still rotate a little bit. So sometimes that can be helpful in these situations. So that's what they talk about with these floating pedals. And then kind of opposite to the anterior knee pain with posterior knee pain, you might want to try some of those adjustments to lower the saddle, move it forward, and such. There's some of the references I used. And that's it. So I think, you know, really serious athletes are using this less and less. A lot of people are getting dynamic bike fits. In fact, the athlete that helped us out today is going for one later. So, so hopefully just kind of gives you an idea if you have someone come into your office and they have a complaint, and you can talk about their bike fit and maybe suggest some of those changes. And if that doesn't help, then you might want to suggest they try to look for a dynamic bike fit, which again, there's different philosophies and different ways to do it. But it's more easily attainable now than maybe it was some years ago.